Meet Denise. Denise is an 8-year-old girl who shows many symptoms of ADHD, including difficulty in situations controlled by others, difficulty sitting still, waiting, listening, paying attention, focusing, and other social problems. Children like Denise will benefit from this program.
This intervention strategy is an after-school educational seminar program for parents, teachers, and students on ADHD with a focus on hyperactivity that will run for 5 weeks. The intervention will involve bringing in medical professionals like doctors, teachers, psychologists, and tutors. Week 1 of the program will be a more formal introduction to ADHD for Denise, her teachers, her parents, and fellow peers. We will have a brief overview of ADHD through a slideshow presentation. This will be quite broad and basic at some points because future sessions will focus on those aspects. What it takes to get the diagnosis of ADHD will also be covered, including going over the specific symptoms of ADHD and a more in-depth discussion of the 3 subtypes and the deficits and characteristics that accompany each. There will also be information on how ADHD may present itself as Denise ages into adulthood, as well as common treatments used and therapy methods. There will be 2 activities in this session to put parents in the shoes of their child, demonstrating how difficult it may be to pay attention and how retaining new information can be overwhelming. To end this session, there will be a question period where teachers, parents, and even the children can ask any remaining questions they may have about ADHD. This session will allow Denise and her parents to get a better understanding of ADHD in order for them to further understand what is going on with Denise and why.
Week 2, Biological. A medical professional will introduce the biological and medical aspects of ADHD. Here, the medical professional will run interactive activities about the basic facts of ADHD. The medical professional will go over facts about how the brain functions differently in children who have ADHD compared to children who do not. Some of the aspects that the professional will touch on will include executive functioning, working memory, response inhibition, attentional control, and emotion regulation. The professional will also make note of medication as a treatment, both the positive and negatives. The session also includes an interactive game that helps students understand that their brain takes input information and transfers it to output behavior. Parents and students are encouraged to ask questions. Learning about the biological aspects of ADHD will help Denise and her family understand why Denise can't sit still or why she is unable to focus on her work in the classroom.
Week 3, Psychological. As discussed in the previous weeks, children who have ADHD can have trouble learning effectively and can unintentionally cause disturbances in the classroom. This week will focus on the psychological and behavioral aspects of ADHD, and it will explain that it is difficult for children with ADHD to realize the consequences of their hyperactive behaviors. We will go over techniques and strategies that teachers and parents can use. Some of these strategies include immediate feedback concerning their behavior, frequent reminders, and self-control reward systems. The psychologist will go over a variety of psychotherapy-based interventions. Included in these are basic behavior therapy, parent training, cognitive therapy, and a variety of psychoeducational interventions. Throughout this session, there will be opportunities for discussion and a role-play activity at the end. This week of the program will help Denise and her family learn strategies and techniques that can be implemented in order to help reduce and/or control her hyperactive behaviors both in and outside the classroom.
Week 4, Sociological. Teachers will discuss students' classroom behavior and expectations as well as homework goals with parents so they can work together to ensure the child's success and introduce techniques like homework charts. For someone like Denise who starts many projects at once and has trouble completing them, writing down smaller, more obtainable goals will prove to be effective. Consistency between home learning and classroom learning, as well as parent-teacher collaboration, is crucial for children like Denise to be successful in their academics. Week 5, Collaboration. During the final week of the program, all the different professionals will be present in order to take any final questions or concerns around ADHD management and emphasize their take-home messages to the parents and students. Overall, this week gives professionals an opportunity to hear from other fields as well as their own. Transdisciplinarity is a key aspect of this program as it brings together these various disciplines to address one common area. As well as these professionals, outside resources and supports will be provided to Denise, her parents, and teachers. Denise's progress following the program will be monitored for further intervention or further research.